Diet is one of the most important factors when it comes to a new diagnosis of diabetes mellitus. As you know, diabetes is caused by an insufficient amount of insulin in the body to regulate those blood sugar levels. So the first step in diabetes management is blood sugar management, which is controlled by, you guessed it, diet. The most important part of eating for the diabetic patient is receiving the correct balance of proteins, fats, and carbohydrates, all things your body needs every day. The amount of proteins, fats, and carbs that you should ideally eat daily can be sorted out into percentages. 10 to 20% of the calories you eat should be from proteins, 25 to 30% should come from healthy fats, which we will discuss later, and 50 to 60% of the calories you eat should come from carbohydrates. Diabetic diet management should be a group effort. In other words, support from the family regarding change in the child's diet is critical for the child's health maintenance. So, the American Diabetes Association has many resources on the types of foods you should include in your child's diet and the ones you should avoid. Let's start with protein. Lean proteins are the optimal choice for a diabetic diet. Lean proteins include fish and seafood, chicken, beef, pork, turkey, eggs, low-fat dairy, and even non-meat protein sources such as beans, nuts, and seeds. For poultry such as chicken and turkey, make sure the skin and excess fat is trimmed off to avoid that excess level of fat. And sources such as beef should be about 80% lean meat, 20% fat for stuff like ground beef. Now there are also protein sources that you should avoid, specifically those high in fats. These sources include fried meats and fish, pork ribs, pork bacon, and regular cheeses. Next, we will talk about fats and those that are healthy and those that should be avoided. Fats, or lipids, are naturally occurring and you do need these sources of food to survive. Vegetables, such as avocados, seeds, nuts, tuna, salmon, and plant-based oils such as olive oils are all sources of natural fats. On the other hand, excessive levels of trans fats or saturated fats, which can be found in sweets such as chocolate bars, cake, and candy, as well as that fried chicken and fried fish, should be avoided. You can determine the levels of these fats by reading food nutrition labels before buying. High levels of these bad fats could increase the chance for hypertension and heart disease. Lastly, we will discuss the good and bad carbohydrates to eat. Carbohydrates, or carbs, can be broken down into four main categories: vegetables, fruits, starches, and dairy. Fresh vegetables and greens such as kale, spinach, and arugula, and canned vegetables low in sodium should be a big part of the diet. On the other hand, canned vegetables high in sodium or veggies cooked with a lot of butter, cheese, or other sauces should be avoided, as this increases the amount of sodium and saturated fats in the diet. Fresh or frozen fruits are great for a sweet treat, but canned fruit and sugary syrups or fruit juices, like apple juice, should not be eaten because these items are high in sugar. And remember, with a diabetic diet, our main focus is the control of sugar. Starches are the next subcategory of carbs and arguably the most difficult to regulate. For the diabetic patient, you should include whole grain starches such as brown rice, oatmeal, and quinoa, and avoid the processed starches like white rice, white flour, sugary cereals, white bread, and even flour tortillas. Last on the carbohydrate list is dairy. The main things to remember when consuming dairy is to get it low fat or non-fat. So things like 1% or skim milk, low fat yogurt, low fat cottage cheese, or low fat sour cream are things that your child and family can enjoy, while dairy items such as whole milk, full fat yogurt, or ice cream should be avoided. Another good point to mention when it comes to the diabetic diet is beverage choices. Water, unsweetened or lightly sweetened tea, and black coffee with some light cream or artificial sugar are great beverage choices. But sugary drinks such as sodas, highly sweetened tea, coffee with lots of cream and sugar, or even energy drinks should be avoided, as these items contain a lot of hidden sugars. All in all, it is important for you and your child to know that the diabetic diet is not a punishment, but a plan to reduce any complications that could occur due to a poorly planned diet. It is also important to note that a sweet treat is allowed every once in a while, as long as it is planned and does not occur on a regular basis.
Hi, I'm Isabel, and today I'll be explaining how to use the Freestyle Libre 2. I have a quick PowerPoint to help you visualize what I'm explaining. So the Freestyle Libre 2 is a continuous glucose monitoring device, and it is composed of a sensor and a handheld reader. So the sensor is placed on the back of your child's upper arm and stays on for 14 days. Some benefits is that it's continuous monitoring, so a glucose level is read every minute. There's no finger sticks needed once the sensor is on. All they have to do is scan it, and it's water resistant, so they can still go to the pool with their friends. They can wear it in the shower, so that's great. The sensor is super small and discreet, so it's not easily noticeable. They can also cover it under clothes and just scan through their clothes. That is perfectly fine. It can also be worn while they're asleep, so that's great. And it works by reading the glucose levels in the interstitial fluid. So that is the fluid that surrounds the cells in the child's tissue. It doesn't go into the blood, and it's a super small sensor filament. So you can see it doesn't cause any pain while they're wearing it. So how to apply the sensor? First, you want to make sure that the area is washed, clean, and dry. So after you wash with soap and water, disinfect the area with an alcohol wipe, and then let the skin air dry before applying the sensor. To prep the applicator, you want to open the sensor pack and then unscrew the cap from the applicator and line up the marks on the sensor packs and the applicator. Then press down firmly and lift, and a sensor should be attached to the applicator. Then apply the sensor to the back of the arm with the applicator. Press down firmly, listen for a click, and wait for about 30 seconds before pulling back the applicator, and the sensor should be in place. As you can see, this is a child scanning their sensor with their handheld device. So you can, once you've set up the sensor, you can set up the handheld reader. So you want to turn on the Freestyle Libre. The only button on the device is the on button. The rest is touchscreen. So then once it's on, you tap scan new sensor, hold up the reader to the sensor, and let it warm up for about an hour before taking the first reading. You can also set alarms, which is a really nice feature for if the glucose goes too high, too low, or if the sensor is no longer picking up readings, then it can also alarm. These are optional and can be turned on and off and adjusted to your child's personal glucose levels. So they also show trends on the glucose handheld reader, whether their glucose is going up, going down, and it's really good to monitor their progress throughout the day and over time. So one thing that is important to note is to remind your child to scan their sensor every 8 hours, otherwise there will be gaps in their data. So to avoid that, just make sure they scan at least every 8 hours, and they'll have a better complete picture of their readings. There's also the Freestyle Libre 14-day system, just to mention this. So once your child turns 18, they can get this system, and instead of using a handheld device, they can actually use their cell phone, and it works just the same way. They can scan with it, they can monitor their trends, and then there's also an app where you can, the parents can share information from the reader, so their child can invite whoever they want, their parents, their roommate, if they're going off to college, and someone else can also keep track of their levels. So that's an awesome feature as well. And if you have any more questions or just want some more detail, I've linked all the social media pages and the website for more detail. And that is it. So thank you. If you have any more questions, let me know.
Hello, my name is Alexis Shedd, and I'm a student nurse at Clemson. And I'm going to be talking to you about your child's use of an insulin pump. So the benefits of using a pump is that it's easy to manage. It's a lot easier than having to administer insulin throughout the day. With this, it's got the insulin. Let's see if I can point to a good. So it's got the insulin, this little canister right here, twists inside of the pump, and it has a little vial of insulin that it just slowly administers throughout the day. So it's like a basal insulin, like Lantus would be, but you're not having to inject yourself like you would. This little piece right here is a little cannula that has to be changed every 2 to 3 days, along with the tubing and the vial of insulin. This piece that connects to the tube and connects to the pump can be taken off, like you twist it off in order to take showers, or if you need to do activities like that. The only thing with this pump is it doesn't just automatically know your blood sugar. You will still have to, calculate your blood sugars, know the symptoms of hyper and hypoglycemia like you normally would. And you just have to know, if you're going to be sick, or if you're sick, or if you're going to be exercising, or eating a large meal, or, just meals in general. You're going to have to know to program it in the pump. The biggest things with these pumps is you're going to be carb counting, depending on how many carbs you're going to have that day and how high your blood sugar is. You're going to have to know to program the boluses in the pump. But that will also be with your basal insulin that you're going to be getting throughout the day. Some people can also use a continuous glucose monitor. So this can also be injected like the cannula over here, and it'll communicate between the pump, and it measures the glucose every 5 minutes to calculate your insulin dose. The only bad thing about this, well, really not bad thing, is there is a few minute lag compared to getting your the finger prick. So that could be a difference, especially if there's a high situation to where you're having a hyper or hypoglycemic episode. So just making sure your child keeps up with this, because not wearing the pump or not changing the tubing like you're supposed to, where it could get kinked or get clogged, can cause a hyperglycemic episode, where essentially they can have DKA. So it's just important to make sure they wear. This could be something great for them while they're in high school or playing sports, something that it's not as hard to manage with their type 1 diabetes. Thank you.
With diabetic patients, just eating right isn't enough, so it's important to maintain activity and exercise as well. There are a lot of different forms of exercise based on what your child may enjoy, such as participating in sports, riding a bike, running, working out, or even just walking the dog. So there are a lot of different options, and there are many ways to make it more enjoyable for them. I think the best way to start with that would be by setting a goal. Preferably setting aside 30 to 60 minutes a day to exercise or do some sort of outdoor activity. As we know, exercising habits can be really hard to develop at first, so it's always good to switch up activities or get creative with it in order to make it more fun and enjoyable for them. It's important to notify the provider if your child decides to pick up any new sports or activities that may increase their activity level or intensity, because it could alter their blood sugar levels, and we want to try to prevent those from being too high or too low. So in these situations, the provider may adjust the medications or their testing schedule in order to maintain their well-controlled diabetes during those activities. I would also make sure that your child always brings snacks and water and informs any coaches or instructors about their diabetes, just in case they need to stop during that activity or in case there is an emergency. I would also look into getting a medical alert bracelet for your child to have at all times. As a parent, I think that it's really important that you continue to be open and encouraging with your child and their activities. So if you show any fear or nervousness or withhold them from participating in that activity, it may reinforce your child's sense of being different or having a disease. So we just need to remind them that they are just like any other kid on the team, and we just need to take a few extra precautions, and that's okay. It's also important to be open and honest about their diabetes so they learn the signs and symptoms of having high and low blood sugar, so they know when to stop exercising or when they need to take a break to eat a snack or something. So regarding school, it's important that you or your child talk with their teachers and also the school nurse about their diabetes. You can provide them with papers or any sorts of brochures about your child's testing schedule or their medication schedule if you want. It's important that your child learns to manage their diabetes away from home, but also informing those extra people allows them to also be aware of it and to help keep that child accountable for it as well. It's also important that your child knows who to contact for help, how to handle eating situations at school or away from home, and that they have all the supplies and snacks they need to manage their diabetes. Other than that, just be sure to check in every once in a while to see how it's going at school or during their activities and how it feels to manage their diabetes away from home. Getting those updates on their thoughts and feelings about it can help you understand where they are with controlling it and what they may need more help with.
With diabetes, there are some signs and symptoms that you need to be on the lookout for at all times. If you experience any of these symptoms at any point, you need to call your doctor or your healthcare provider immediately. In some cases, you may need to call 911 or have somebody drive you to the emergency room. The first one that we're going to talk about is hyperglycemia. With hyperglycemia, you have too much sugar in your blood that can potentially lead to life-threatening complications. So with hyperglycemia, you may be feeling very thirsty, you may be going to the bathroom more often, you also may be experiencing some blurred vision, headaches, or some dizziness. If you are experiencing any of these, you need to call your doctor immediately. If you do not take care of your hyperglycemia immediately, it can eventually lead into something called DKA. This is called diabetic ketoacidosis. This is a life-threatening event and you need to seek treatment immediately. With DKA, you could be experiencing abdominal pain, feel nauseous or vomit. You may also be taking deep, rapid breaths, and your breath may smell fruity, almost like you have alcohol or something on your breath. You may also be experiencing confusion or dizziness. If you're experiencing any things, make sure to go to the doctor immediately. So on the other hand, with hyperglycemia, there is also hypoglycemia. With hypoglycemia, you may be feeling faint, weak, dizzy, or hungry. You may also be confused or not entirely there as the low blood sugar is affecting how you think. Your skin will be cool and clammy to the touch, and you may also be sweating a lot. Before you call your doctor, you need to make sure you eat something to maintain your sugar levels and then call your doctor. Your doctor's office should provide you with their phone number as well as an emergency contact number. If they do not pick up or return your call soon, you need to hang up and go to the emergency room or call 911 and get life-saving measures started.
Since your child is 16, let's talk about ways to engage your child in their own care on their own level. As an adolescent, your child can understand most of their disease process and care. Teenagers can understand abstract thought, so educating them about the way that insulin facilitates the use of glucose in their bodies could be helpful to them. By this age, most teens have taken some sort of biology class which will make the pathophysiology of type 1 diabetes mellitus a little bit easier to understand. Since adolescents strongly value independence, allowing them to make their own decisions is an important way to involve them in their care. Although they can't decide whether or not they're going to take insulin, you may still offer your teen the opportunity to make decisions such as, your blood sugars are a little low. What kind of carb do you want? Would you like to give yourself the shot or should I? Or would you prefer to give shots manually or maybe get a pump? Asking questions like these and respecting their decisions will give them some control over this new diagnosis. And telling your child that you are proud of him or her and the way they're handling all this is always a great way to increase self-esteem and motivation to take responsibility. According to famous psychologist Erik Erikson, 16-year-olds fall into the psychosocial category of identity versus role confusion. This means that your child is right here, right now, deciding who they are and what their role is. Therefore, it is important to allow your child to take ownership of their disease, but not be defined by it. Peers are also a critical part of the adolescent years. Introducing your child to others with type 1 diabetes is a great idea, whether that's at school, church, or through organized clubs. Meeting peers with the same diagnosis will make your child feel like they aren't alone. Their friends can also teach them the tricks and tips that they found to help them live with diabetes and actually encourage your child to take care of themselves better. With a diagnosis like diabetes, medication compliance is essential. Try not to scare your kids, but let them know that their actions have real consequences. Skipping a dose of insulin or guessing your carb count for the day can land you in the hospital. Hypoglycemia and diabetic ketoacidosis are real, life-threatening possibilities for uncontrolled diabetics. It is important to let them know that they are the ones who will have to live with the consequences of their decisions. And it's always important to be honest with your child. This process is going to be hard and it's going to change the way that you live. But we as the hospital staff and you as the parents are here to support them every step of the way.